Hello and welcome to Take Your Medicine. On today's show, I will be discussing the different types of blood pressure medication that is commonly seen in retail pharmacy. Prescription antihypertensive drugs come in a variety of different classes. The classes of antihypertensive drugs include ACE inhibitors, diuretics, beta blockers, angiotensin II receptor blockers, calcium channel blockers, alpha 2 receptor agonists, peripheral adrenic inhibitors, central agonists, vasodilators, and also we have combination drugs. That's a combination of the different classes that are put together in one dosage form. I will take you through each class of drug, noting what they do in the body, their names, their drug names, their effects. If the medication you're on is not discussed today, then it's best that you seek the advice from your healthcare provider and your pharmacist, as they would be the best source of information going forward. So let's get on with the first class of drug. The first class of drug we'll be discussing is called the ACE inhibitors. ACE stands for angiotensin converting enzyme. Angiotensin is a chemical that causes constriction of blood vessels, especially in the kidney, but also throughout the body. This in turn causes an increase in blood pressure. ACE inhibitors help the body produce less angiotensin, thereby causing a dilation of blood vessels and therefore decreasing blood pressure. Common drug names for ACE inhibitors are captopril, enalapril, lisinopril, perindopril, ramipril, trandolapril, fosinopril. As you can see by their names, most of these drugs end with the letters PRIL. This makes it easy to identify this class of drug when looking on the package insert. The most common side effect that I have noticed with this drug is a constant dry hacking cough. If you are on one of these drugs and have been coughing for more than a week, then it's best that you speak to your doctor about maybe changing your drug to a different class, as this side effect would persist. Other side effects include a skin rash, a loss of taste, postural hypotension, which is quite common with many hypertensive drugs. So postural hypotension is when you wake up or stand up too fast, your body's receptors take a split second longer to adjust to that change in direction. This may cause you to feel dizziness and vertigo. One thing to note with this class, it's definitely not used in pregnancy. The next class of drug we'll be looking at is the diuretics. The diuretics, or as most patients refer to them, as water pills. The reason for this is because diuretics remove excess water and sodium from the body, and this helps to lower blood pressure. It does this by decreasing the total circulating liquid content of the body. By having less circulating liquid in the body's organs, especially the heart and the kidney, have less volume of blood and liquid to pump and filter respectively. Therefore, there is a decreased workload on them, making them more efficient in their jobs. Common drug names include chlorothiazine, hydrochlorothiazine, indapamide, chlorothiazidone. These are known as the thiazine diuretics. Furosemide and butenamide are known as loop diuretics. Amiloride, spironolactone, triamterene are known as the potassium-sparing diuretics. In some cases, we do have combination diuretics in some dosage form preparations. The most common side effect that I have noted with these class of drugs is muscle weakness and leg cramps. This is more typical since these drugs cause a loss of the sodium salt and also potassium in some cases. If you experience any of these symptoms and you are on a diuretic, please speak to your doctor about your medication and alternative options. Other side effects may include acute gout with long-term use of diuretics and also In some cases, it may increase the blood glucose level of diabetics. Also, in males, impotence may occur. The next class of drug we'll be looking at is the beta blockers. Beta blockers help to block the beta receptor that's found in the body. Betas are found in many areas and organs throughout the body. If they are stimulated, they can cause an excitatory effect, thereby causing narrowing of the arteries, which can then increase your blood pressure. So by blocking these receptors, we have a decreased workload on the heart, a decreased heart rate, a decrease in output of blood from the heart, thereby reducing the stress on the heart. This in turn helps to lower the blood pressure. Common beta blocker drugs are ace-butanol, atenolol, bisoprolol, propranolol, timolol, metoprolol. As you may notice, most of these drugs end with the LOL. Side effects for beta blockers include insomnia, cold hands and feet, slower heartbeat, fatigue, impotence in males, and importantly, also tightness in the chest. Asthmatics should not use beta blockers, as this may block the beta receptors in the lung. This can lead to treatment failure of their asthma medication. This is particular the case in non-selective beta blockers, but as I said, guys, always consult your doctor when asking about these things, as they would be able to advise you better regarding your medication and your treatment plan that you're on. The next class is the Angiotensin II receptor blocker. These work by directly blocking the angiotensin chemical, which is responsible for the increase in blood pressure by causing a constriction or narrowing of the arteries. Angiotensin II needs to bind to a specific receptor, then only can it exert its constrictory effect in the body. Angiotensin II blockers block the angiotensin receptor, thereby the angiotensin II cannot interact with the receptor, and therefore we get a decrease in blood pressure. Common angiotensin II drugs are candesartan, losartan, valsartan, irbesartan, telmisartan. Common side effects are dizziness, but in practice, dealing with my patients, the most common side effect that my patients have experienced on these class of drug has been an increase in allergic conditions. The next class of drug we'll be looking at is the calcium channel blockers. This class of drug prevents the calcium molecule from entering the smooth muscles found in the heart and arteries. Calcium causes a more forceful and powerful contraction of the heart muscle. Therefore, by decreasing the amount of calcium entering that muscle, the heart contractions are less forceful, therefore less strain on the heart. The calcium blockers therefore help to relax and open up narrow arteries in the body. They decrease the heart rate and therefore decrease blood pressure. Common drug names are amlodipine, felodipine, diltiazem, nifedipine, verapamil. Common side effects include headaches, dizziness, swollen ankles, and also heart palpitations. The next class we'll be looking at is the alpha blockers. The alpha blockers are similar effect to the beta blockers, that once they are stimulated, they will cause an excitation effect and therefore cause narrowing of the blood vessels, which will then increase blood pressure. So by blocking them, we'd get a dilation of the blood vessels and lowering of blood pressure. They will help to reduce the artery's resistance, and they also help to relax the smooth muscle of the vascular walls. Common drugs used in this class include doxazosin, prazosin, terazosin. Common side effects include a faster heart rate, dizziness, and postural hypotension. The next class is the alpha-2 receptor agonist. These drugs lower blood pressure by decreasing the activity of the sympathetic pathway in the involuntary nervous system. The sympathetic system means the adrenaline producing portion of the involuntary system. So we know that adrenaline pushes blood pressure up. So these drugs block that from happening. The most common and widely used of this class of drugs is methyl-dopa. This is first-line treatment in pregnancy. Common side effects include dizziness and drowsiness. The next class we'll be looking at is the central agonists. These drugs decrease the blood vessel's ability to contract. They follow a different nervous system pathway when compared to the alpha and beta blockers. Common drugs used in this class are alpha-methyl-dopa and clonidine. Common side effects experienced with these drugs include postural hypotension, dizziness, fatigue, impotence in males, and dry mouth. The next class we're looking at is the peripheral adrenic inhibitors. This class of drug lowers blood pressure by blocking specific neurotransmitters in the brain. Neurotransmitters are what sends messages to the body. So by blocking this, you block the message from the brain to tell the blood vessel to constrict. So if you prevent constriction, you prevent high blood pressure. A common drug in this class is rezapine. Side effects include stuffy nose, diarrhea, heartburn, insomnia, and if you experience depression, you should consult your doctor. The next class we'll be looking at are the vasodilators. These drugs cause the muscles in the walls of the blood vessels to dilate. So by relaxing the muscle walls, the blood vessel opens up wider, and therefore you get better blood flow and a decrease in blood pressure. Common drugs in this class include hydralazine and minoxidil. Common side effects include headaches, painful joints, heart palpitations, swollen eyes, and also fluid retention. The drug minoxidil is commonly used in severe kidney failure. The last thing we'll be talking about is the combination drugs. So many drug companies actually combine many different classes of drugs, especially anti-hypertensive medication, when formulating their product. Common examples are an ACE inhibitor with a diuretic, or an angiotensin II blocker with a diuretic as well, alpha and beta blockers that are combined, ACE inhibitors together with calcium channel blockers, but there's so many variations and varieties out there in the market. I know today was a long show and a lot of theory going into it. So if you guys are on any antihypertensive medication, I hope watching today's show you got to better understand the drug that you're on, how it works, and the side effects that you may be getting with it. So any questions you guys may have, please leave it in the comment section and I'll get back to it as soon as I can. Also, if you enjoyed today's show, please hit the like button, also subscribe and hit the notification bell to alert you to all upcoming episodes. Thanks again for joining me today, guys. Take care. Bye-bye.